मैडम
हाँ
मैडम नमस्कार मैडम मोर क्लास अच्छी बोधे एबे
10 रे मोर बोधे मते जहा देइचंती लेट मी चेक अरे मौसुमी
मैडम
10-2 मोर साइकोपैथोलॉजी
मु ताहले अलगा लिंक टा को मैडम जॉइन कर देइची आउ अलगा लिंक को मैडम जॉइन कर देइची
अच्छा अच्छा
काउंसलिंग रो मोरटा अछि मु आ गोटे लिंक रे जॉइन कर देइची
ओहो
मु लीव करछि मैडम सेइथिरे जॉइन करछि
ओहो
लिंक टा भूल जॉइन करछि ताहले हो
गुड इवनिंग एवरीबॉडी गुड इवनिंग एवरीबॉडी
Good evening, ma'am.
Good evening, ma'am.
so I am audible
Ma'am, এটা লিঙ্কটা কাউন্সিলিং রতা
Ma'am, এটা counseling na? Counseling psychology?
साइकोपैथोलॉजी
No, ma'am.
MPCE-21. Counseling psychology.
काउंसलिंग साइकोलॉजी
Yes, ma'am.
ओके देखे सो
Good evening, all. Am I audible?
Good evening, ma'am.
Good evening, ma'am.
So today we will be discussing your first paper in counseling psychology. That is your block 1 in counseling psychology. So all of you are from psychology background or you are from different background?
Ma'am, I'm from commerce.
Manisha Rani is from commerce. Rupali Das, what about you? Debasmita Panigrahi? Debasmita Panigrahi?
I'm from management, madam.
Then Anushka Maharana? Anuksha Maharana?
Yes, ma'am.
You are from which discipline?
Counseling.
Counseling. The next is Madhu Smita Sadangi. Madhu Smita Sadangi, are you there?
I am from psychology.
Rupali Das? Divya
Ma'am,
Gupta?
education, ma'am.
Rupal Education. हाँ. Divya Gupta?
Yes, ma'am.
You are from which branch?
Ma'am, psychology.
Psychology.
Yes.
Sita D. D Sita.
Ma'am, counseling psychology.
No, now you are in counseling psychology. You have opted counseling psychology, but what is your background?
In psychology, ma'am.
Psychology.
Okay.
I hope all of you can understand Odia.
Yes, ma'am.
Yes, ma'am.
So today I will be covering your first paper, that is counseling. What is counseling? What is psychotherapy? What is guidance, and all these things? Who is a counselor? What are the theories of counseling? Different, every discipline is based upon a particular theory that we will be discussing today in your first block. And then what about the factors that influence counseling? What are the techniques that are being used by a counselor? All these things we will be discussing today. I am Mosumi Sethi. I am assistant professor in Utkal University Psychology Department. So let's start with this introduction to counseling. Hope all of you have your books or e-books with you.
Yes, ma'am.
So you can open your book so that you can follow me. Usually I prepare PPT for your classes, but due to lack of time I could not prepare the PPT. I thought it would be better if I show you what is written in the book, that so that you can relate with that book and you will find interesting studying the course. So first we'll start with what is counseling and what are the characteristics of a counselor. So any idea about counseling? What is counseling? What is counseling? Any idea? Actually, this is your doubt clearing class. This is not a classroom teaching you are going through now. Here you are required to ask your counselor about the doubts you are having in the particular paper. If you have any doubt, then ask me, or else I will go on telling you what is there in the book. Do you have any doubt for this block 1? କିଛି doubt ଅଛି ନା ମୁଁ ଖାଲି ପଢେଇ ଚାଲିବି?
Ma'am, you can just cover the course. In the meantime, we'll be asking the doubts.
You are required to come prepared with your doubts actually. I'm not supposed to teach you the whole paper because it will take at least a month to cover this a single paper. So you
Ma'am,
are.
what is the difference between counseling and guidance?
So first tell me what is counseling, then I'll tell you the difference between
Ma'am,
guidance and
counseling basically means where we help people to solve their problems
counseling.
uh, by uh, by giving them some advice.
Hmm. Good.
And
What is
guidance,
guidance?
ma'am, I don't know, ma'am.
You don't know. Any one of you who can tell about guidance?
Guidance may be in case of like giving a general advice, but counseling could be something relating to a specific issue or specific purpose.
Specific issue. Good answer. Anyone else who would like to answer? What is counseling and what is guidance? Actually, both of you are correct. There is a thin line between counseling and guidance. Counseling is about making one aware about one's potential, making one aware about his weaknesses, how to overcome that weakness, and all these things. Here, the role of the counselor is to make the client powerful, make the client help the client to fight with his or her own problem instead of fighting with the problem of the client. Here the counselor strengthens, empowers. These words can be used in case of counseling, whereas guidance is a concept where the counselor or the guide gives some advice, suggestions where the client is not actually aware. The client doesn't know what to do, what not to do. In case of guidance, we can say a particular term, that is guidance is a pre-process, whereas counseling is a post-process, where there is a specific problem faced by the client. It may be emotional, it may be behavioral, it may be social, it may be interpersonal. In that case, the counselor helps the client. But in case of guidance, this is a pre-process where suppose your student wants some guidance in the field of choosing his or her career. Your student finds it difficult to study mathematics. Your student finds it difficult to get information about any journal, how to publish a paper, how to write a paper, how to deliver deliver a talk, a speech. In that case, you can guide your student. So this is the basic difference between counseling and guidance. Both can be done by the counselor. Any other question?
Ma'am, if you could just throw some light on counseling and psychotherapist.
What is psychotherapy?
Maybe using certain psychological interventions to heal someone or to give some counseling method.
Whatever you are saying is correct. In our life, we face various types of problems in our family, with our friends, emotional issues, various type of mental, excluding physical issues. Everything else comes under the purview of psychology. So psychotherapy is a technique that aims at dealing with these mental issues. Counseling is about a moderate level of emotional psychological issues, whereas psychotherapy is about the mental disorders. When we deal with mental disorder, only a psychotherapy or a person who is trained in psychotherapy can help. So starting with this definition of counseling, it's we can say that it focuses on the development and prevention of serious mental health problems through education and short-term treatment. So, counseling is there to benefit a person experiencing problem in finding, forming, and maintaining any type of relationship. When this is a relationship issue, when there is some emotional issue, then the counselor helps the person to overcome those emotional issues. And the techniques that are being used by the counselor is by patiently listening to the problems, to the issues faced by his or her client. So some of the theories of counseling says that every individual is powerful, is well equipped, is full of potential in itself, it in himself or herself. So it's the role of the counselor to make the person realize about his full potential, his strengths, his power to overcome the problem he is facing at present. So, counselor help the person to solve the problem on his or her own by utilizing his or her own problem. So, you must be knowing about Mahabharat, the story of Mahabharat. Hmm?
Yes,
All
ma'am.
of
Yes, ma'am.
you, huh? All of you know the story of Mahabharata.
Yes,
Yes,
ma'am.
ma'am.
All of you must be knowing about Bhagavad Gita.
Yes, ma'am.
So, what is Bhagavad Gita actually? What
Ma'am, in
is it?
Bhagavad Gita, Krishna explained about the life therapies, मतलब कि life में क्या क्या होता है,
Hmm.
to Arjun.
Hmm, hmm, hmm. Anything else? लाइफ में क्या क्या होता है यही बताते हैं.
लाइफ प्रॉब लाइफ प्रॉब्लम्स के बारे में, मतलब कि ही टीचर्स हिम कि कैसे लाइफ के प्रॉब्लम्स कैसे फेस
मैडम
किए जाते हैं, फिर सॉल्व कैसे किए जाते हैं.
मैडम
Somebody, हाँ,
हाँ, गीता में ये बताया गया है जब अर्जुन युद्ध नहीं करना चाह रहे थे तो फिर वो क्या क्या कारण से उनको कन्विंस किए, वो चीज उसमें भगवत गीता में बताया जा रहा है, ये हमारे लिए क्यों जरूरी है और जो हमारा मोह माया जो भी है उनका रिलेशन के लिए या जिसके लिए भी, तो वो उनका ज्ञान दिया गया है.
उसका ज्ञान दिया गया है. गुड. So what happens in Mahabharata? Arjun doesn't want to fight against his kin and kith. He doesn't want to fight against his blood relatives, against his grandfather, against his father's elder sister, against his cousins. In that situation, Arjun was actually clueless about what to do. He could not convince himself that it is proper or it is right to fight against his kin and kin. He was confused. He knew he was the most or he was the best କ'ଣ ସେ ତାଙ୍କୁ କହୁଛନ୍ତି ଧନୁର୍ଦ୍ଧର of that time, but he could stop the war in a day, but he was actually not willing to fight against his own people. In that situation, or Krishna, he asks Krishna some questions and Krishna's answer is written or documented as Bhagavad Gita. Krishna Bhagwan here says the problems or what is the reality of life, what to do, what not to do. He convinced Arjun that it is not wrong to fight against his kin and kin. When there is a need to fight, when there is a need to prevail dharma, then it's the duty of Arjuna to fight. He can fight against his kin and kith to save dharma. ଧର୍ମର ରକ୍ଷା କରିବା ପାଇଁ କି ସେ ତାଙ୍କର ବ୍ଲଡ ରିଲେଟିଭଙ୍କ ସହିତ ଫାଇଟିଂ କରିବାରେ କୌଣସି ଅସୁବିଧା ନାହିଁ. ସେଇ ଜିନିଷଟା ଗୀତାରେ କୃଷ୍ଣ ଅର୍ଜୁନଙ୍କୁ ବତଉଛନ୍ତି. And all the verses, all the sentences said by Krishna is documented as Bhagavad Gita, and that is called actually the most uh, powerful, the most ancient counselor we can say is Arjuna, Sri Krishna, and the client was Arjuna, where Sri Krishna makes Arjuna realize about his potential, what is good, what is. Sri Krishna did not touch a weapon. ସେ ନିରସ୍ତ୍ର ରହିଲେ, ସେ କୌଣସି ଅସ୍ତ୍ର ଧରି ନଥିଲେ. He didn't fight for Arjuna or the Pandavas. He simply guided them. He simply counsels Arjuna in the Yuddha Kshetra, and that is what we know as Bhagavad Gita nowadays. So this is called counseling, and counseling involves guidance also. In case of guidance, it is done at a prior level or before identifying any problem. When someone comes for your help, it is called as guidance. So Biswalo defines counseling as the process of helping an individual to accept and use the information and advice so that he or she can solve his or her present problem and cope with it successfully. So, counseling is not all about giving advice, directing, dominating, ordering someone to do a particular act. It is a professional act which is based upon certain principles. So, American Counseling Association and a division of 17 of the American Psychological Association have defined counseling in different occasions, and these are the definitions. It's a profession. It deals with personal, social, vocational empowerment and educational concerns. It is conducted with persons who are considered to function within the normal range. When a person is not within his normal ability, normal behavior, when a person acts abnormally, that can only be treated through psychotherapy. A counselor cannot help in that situation. Once a counselor identifies that this is not about any maladaptive behavior, this is not about any emotional disturbance, this is much more than all these things, he should refer that to a psychotherapist or a psychiatrist. So counseling deals with normal individual, whereas psychotherapy deals with people with some mental disorder, mental issues. And it is usually done in a structured setting. It's a process in which the client learns how to make decision. The counselor empowers his client to think rationally, to take decision on his or her favor. And once the decision is taken by the client should also act upon the decision he has taken. He should clarify his thought process, he should refine his feelings, he should develop his thinking and act accordingly, or show that sort of adaptive behavior or behavior that is beneficial for him and the people around him. It encompasses various specialties. Now, coming to guidance, as you asked, it's a term used to denote the process of helping an individual to gain self-understanding and self-direction so that he can adjust maximally to home, school, and community. It has more to do with something you are not sure of or something you don't know about, and you have someone who is familiar with this type of situation, or someone who has experienced such problem, or someone who has expertise in that area. We usually go to that person for guidance, so that suppose I am going through some legal issues, I am fighting for my own, but in this case I may refer a lawyer who can guide me in this regard, because I feel that the lawyer has the expertise who can tell me about the legal procedure, the laws, the procedure, how to fight for my cause. So someone who provides guidance offer you suggestion how to explore various alternatives And counseling may also offer suggestion, but it also tries to teach you methods for reaching your goal and can help you determine what your goals are. Guidance is not about your goals. Guidance is once you have set your goals or you are thinking of setting your goals here. But in case of counseling, the client is simply in a confused state. So guidance is a pre-problem issue, whereas counseling is a post-problem technique. So guidance is a pre-problem, that is there is no specific problem that is being identified by the individual. He needs guidance, but in counseling the person knows that these are the problems, these are the issues, these are the maladaptive behavior, these are the interpersonal issues he is or she is facing, and he or she needs some type of counseling. So now coming to characteristics of guidance. Guidance is a continuous process. It is a positive program geared to meet the need of all people. It is both generalized, and guidance can also be in specialized service, as when you take guidance about your career, when you take guidance about your about, as I said, some legal issue. So usually guidance refers to the help taken by the students from the teachers, lecturers, advisor, while choosing any particular subject, particular stream. Before you chose this counseling paper or specialization, you must have taken some guidance from your seniors or the people who has already done a course in IGNOU. So it's a generic term. It includes information giving and research activity. So it is more information oriented and addresses developmental issues, whereas counseling is more remedial in nature. One of the difference is it guidance deals with developmental issues or issues that uh, takes you further, whereas counseling deals with remedial issues, or it is remedial in nature. Now coming to psychotherapy, it is an intentional interpersonal relationship used by a trained psychotherapist to aid a client or a patient in problems of living, and it focuses on serious problems associated with intrapsychic internal personal issues and conflict. But counseling is not about the most serious issues. So psychotherapy usually involves long-term relationship that focus on reconstructive changes. It provide in both outpatient inpatient setting, whereas counseling deals with minor lighter problem of daily living and is usually provided in outpatient setting. For those who take psychotherapy, they may be admitted into a hospital. Are you listening to me?
Yes, ma'am.
Yes, ma'am. Ma'am, I just had one doubt here. Like
Mhm.
in psychotherapy, I mean, I understood the concept, but what are the therapies used here? Like it is just conversation or any kind of an other intervention as
So
well?
different psychotherapies are there. Different other techniques are there. In counseling, the counselor simply listens, extract the information, or extract the information about the cause of the conflict, cause of the upset mood, cause of the problem the client is facing. But in psychotherapy, and once the counselor knows about the cause, the reason behind the maladjustment or maladaptive behavior, the counselor start working on this by empowering the client about his potential or how he should set goals and how to reach those goals. But in case of psychotherapy, the psychotherapist use various techniques to deal with the problem. Here also the psychotherapist tries to find out the reason behind the serious mental issue, but he uses other techniques also that we will be discussing later in this paper. Hmm? Anything else?
No, ma'am.
So an effective counselor should have the capacity, or he should be that much skillful to identify the negative thinking pattern of the client. And the counselor should be skillful in building of a relationship, with a relationship of trust, where the client will start disclosing about his inner feelings or the conflicts he or she is facing. And once he knows about this, he tries to help the client make positive changes in his behavior, in his thought process, in his cognition, in his feelings, in his emotions, and as well as in his behavior. So the counselor should know the advanced listening skill. It starts with a patient listening to the problem of the client. So, along with this listening, the counselor should know how to develop empathy. He should be empathetic towards the client, and he should be non-judgmental. He should listen to his client with open mind. Unconditionally, he should accept his client, and he should not make any judgment about the client. He should rely on the genuineness of his client. These are the quality a counselor should have. And and here also you can see, mm, the effective counselor requires the skill of assertiveness, the ability to confront a client when it is therapeutically appropriate. He must be competent in their communication. That one more thing is, the counselor should also have good communication skill along with empathy. The counselor should have the communication skill to communicate to his client that he is empathetic about his client. He must recognize the impact of his own personal values, attitude, and self esteem. Confidentiality is also one of important factor in the process of counseling. The counselor should maintain confidentiality. So in the next chapter we will be discussing about the detailed qualities of the counselor. Now coming to the education and training, the counselor should have a master degree in psychology or in counseling. Usually people from different field, they enter into this counseling course. Field of study may include college, student affairs, elementary, secondary school counseling, education, gerontological counseling. Do you know what are the different counseling, different branches of counseling? Marriage and family therapy, substance abuse, addictive counseling, rehabilitation counseling, agency or community counseling, clinical mental health counseling, career counseling, and the related fields. Starting from marital, which is in very much demand now, marital counseling, student counseling, educational counseling, adolescent counseling. These are the things that are in demand now, and in the coming years the demand for counseling will definitely grow to a greater extent. So along with this, there is also a need of counseling in organization, where the people from different area, from the diverse background, work in any organization, and there is always a conflict between the people in any organization. Some of them, they feel that they are ignored. So others feel that they are being given much work. Some of them have some interpersonal relationship issues, they cannot work in a team. In those cases also, there should be a counselor in every organization. So the process, once someone is recognized as a client, once one joins as a counselor, he should be given some training in these particular areas, that is ability to explain the micro skill, demonstrate the skill involved in commencing the counseling or starting a counseling process, evaluation of non-verbal responses and minimal responses. As I said, the counselor should patiently listen to his client. At the same time, the counselor should have the observational skills to clearly observe, or he should have in-depth knowledge in observation so that he can recognize the non-verbal behavior of his client also. Not only what is being said by the client, that should be helpful in dealing with his client or the problem of the client, but also what is not said. Actually what is not said is more important. ଯାହା ସେ client କହି ନାହିଁ, କହିଥିବା କଥାଠୁ ନ କହିଥିବା କଥାର ସବୁବେଳେ ଇମ୍ପୋର୍ଟାନ୍ସ ଅଧିକ। ତ ସେ କାଉନସିଲର should have that observational skill to note or to identify or to notice what is being not said by the client. Demonstrate reflection of the contents and feelings. The counselor should be trained in demonstrating, communicating, exhibiting to the client that he can understand what the client is saying, what his subject is saying, how his subject is feeling. ମୁଁ ତମକୁ କହୁଥିବି ଯେ ମତେ ମୋର ହଜବେଣ୍ଡ ଏଇ ପ୍ରକାର କଥା କହିଲେ ଯେ ମୁଁ ପୁରା ଭାଙ୍ଗିଗଲି, ମତେ ଏତେ କଷ୍ଟ ହେଲା, but as a counselor you are not actually able to understand how I am feeling because you are unmarried, so you don't know how a wife feels when she is being tortured, she is being humiliated by her husband. So the counselor should have the skill, he should have the capability to reflect the content, the feeling of the client, demonstrate the appropriateness of both content and feeling in the counseling process, develop different questioning techniques. This is one of the important thing or important skill of the counselor. The counselor should be trained. Here we are discussing about the process involved in training of counselor. The counselor should be trained in different developing different questioning technique. ଯେତେ question ପଚାରିବ ସେତେ ଅଧିକ you will come to know about your client. ତମେ ଯଦି question ନ ପଚାରି ପାରୁଛ ତାହେଲେ you won't be able to know what is actually going within your client. Understand the risk involved in with some type of question. ଏହା ନୁହଁ ଯେ he should be conversant, he should have the skills in developing question, he should know what should be asked, what should not be asked, and what should not be asked, how those what should not be asked questions should be asked. କେତେ ଗୁଡ଼ା କ୍ୱେଶ୍ଚିନ୍ ପଚାରିବ, କେତେ ଗୁଡ଼ା କ୍ୱେଶ୍ଚିନ୍ ପଚରା ଯିବନି, ଯୋଉଗୁଡ଼ା ପଚରା ଯାଉନାହିଁ ସେଗୁଡ଼ାକୁ କେମିତି ପଚରାଯିବ, that technique should also the client counselor should know, or that in that technique the counselor should be trained. ପିଲାମାନେ ଶୁଣୁଛ ନା ମୁଁ ମୋର କହି ଚାଲିଛି ରେ?
नहीं मैम
मैम सुन रहे हैं।
सुन रहे हो मैडम?
इंटरेस्टिंग ଲାଗୁଛି ନା ବିରକ୍ତ ଲାଗୁଛି, ବୋର ହଉଛ କି?
नहीं मैडम, अच्छा लग रहा है।
नहीं मैम इंटरेस्टिंग है।
ମାନେ ମୁଁ ବହୁତ ଗୁଡ଼ା ତମକୁ ଠିକ ସେ एक्चुअली एक्सप्लेन କରିପାରୁନି, ଏମିତି ସବୁ ଅଛି ବହିଟାକୁ ଦେଖିଲା ବେଳକୁ ମୁଁ ତାକୁ ଫଲୋ କରିବି ନା ମୁଁ ଯାହା ମତେ ସ୍ପଣ୍ଟାନିୟସଲି ଆସୁଛି ମୁଁ କହିବି, ସେଇଥିରେ ମୁଁ ଟିକେ କନଫ୍ୟୁଜଡ ହେଇଯାଉଛି। କିନ୍ତୁ ବହିଟାକୁ ଛାଡିକି ମୁଁ ମୋର ଗୀତ ଗାଇଦେବି, ତମେ ଦେଖିଲା ବେଳକୁ କିଛି ତ ମାନେ क्वेश्चन आंसर कला बेलू कर असुविधा हम, से फॉलो करुच्ची। ठीक अच्छे माने जहाँ कहूँ तुम टे माने मो सहित कोप करने चेष्टा कर, मु तमर माने मोर एक्सपीरियंस आ बही को केमिति ता सहित सेट करके कहबी सेटारे टिके मो मिसमैच हो जाउची बोली मते लागुची। So ठीक अच्छे। So how to use various micro skills? अच्छा, the counselor should also know how to use different micro skill. Micro skill कौन पिला इठी? Micro skill is you are saying me एमिति हैला तापरे मैडम मु एमिति I am your counselor, you are saying me मु से दिन ऑफिस रो फेरिली मु एते टायर्ड हे जी मो हस्बैंड एमिति ये कर। If you are saying me your problem and I am facing towards or I am facing somewhere else, I am scrolling my mobile. The next, I am making such an expression that I want to listen to what happened next. So how would you be feeling? So this is the micro skill. The counselor should show the appropriate behavior. से छोट आखिर माने ब्लिंकिंग हो facial the counselor should convey to the client that he is actually interested in listening to the client. ସେଇଗୁଡ଼ା ସବୁ ହଉଛି ମାଇକ୍ରୋ ସ୍କିଲ୍। ଏଇଥିରେ ଲେଖା ହେଇଛି ସମରାଇଜିଂ କନଫ୍ରଣ୍ଟେସନ ଆଣ୍ଡ ରିଫ୍ରେମିଂ। ସମରାଇଜିଂ କ'ଣ ପିଲେ, ଯାହା ତମେ କହିଲ ଏମିତି ହେଲା, ତାପରେ ମ୍ୟାଡାମ ଏମିତି ହେଲା, ତାପରେ ସେଦିନ ସେମିତି ହେଇଥିଲା, ତାପରେ ବି ମୁଁ ଆଉ ଗୋଟେ ଦିନ ଏମିତି ଆସିଥିଲି, ମୋ ଶାଶୁ ଆସିଥିଲା ବେଳୁ ଏମିତି ହେଲା, ତାପରେ ମୁଁ ମୋର ସାଙ୍ଗମାନେ, so you are saying me a series of incidents. So what I will do to show my micro skill, I should summarize them into a single ओहो एई प्रकार तम हस्बैंड ताहले तुमको बिहेव करचंती हाँ 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 so this what I am saying is a micro skill that actually has a greater impact on the client. से कबा जानी परिबो जे my counselor is actually understanding me, my counselor is actually empathetically listening to me, मु तांको जहा कहूची my counselor is able to understand. Sometimes the counselor summarizes, sometimes he does this confrontation, sometimes he does this on reframing also to show this micro skill. Then demonstrate self-destructive beliefs and show methods of challenging them, including normalizing. This is about the counselor himself. Explain how counseling a client can improve the psychological well-being through making choice that you can understand. Demonstrate effective use of they're coming to this point. Demonstrate effective ways of terminating a counseling session. So suppose you are the counselor and the counseling process has started. In the initial session you comes to know about what is actually going in the mind of your client, why or she has come, which technique you will be using depending upon the problem of the client. ए सब तमरा decide ହେଇगला in the initial session. Then gradually the counseling process goes on, for it may be for 2 3 5 10 sessions also. So once you realize that the problem is getting alleviated, the counselor my client is getting adapted to new form of behavior, new thought process, my client has developed this adaptive behavior, and no more the problem persists, so it's time to end my counseling process. So here the termination starts, and actually the termination is a difficult process. During this process the client becomes so much dependent on the counselor that the client doesn't want to terminate it. Even in some cases the counselor also develops some sort of attachment with the client. So this is a complicated process, and during this process both the client and the counselor they face issues. So that is why the counselor should also be trained in effective ways of terminating, how this termination process can take place in a normal way without any hustle and bustle, that says counseling process will be terminated. That is also taught to the counselor session, and to explain ways of addressing dependency, as I said, with either the client become dependent on the counselor or the counselor develops attachment to the client. That should also, and the trainee should know all these things. Now coming to license, the counselor should have license. Any person without any license, as a doctor should have a license, the counselor should have the license. It is different for different countries. In India, the RCI, Rehabilitation Council of India, provides the counseling licensing service to the person. Usually people who are certified clinical psychologist, they get this RCI certification from Rehabilitation Council of India, that was set up in 1986, and in 1992 the RCI Act was enacted by the Parliament, and it became a statutory in 1993, and it trains master trainers, rehabilitation professional, and personnel for creating better service delivery facility for the person with disability. But it doesn't give any benefit, financial help or material help to person with disability. One of the chief function of this council is to standardize the training courses and training procedure for various categories of professionals, so that the quality of service to the people with disability will be standardized or will be the same. So they have developed 80 long-term, short-term training courses, which includes 11 courses developed during the current year with the help of respective expert committees constituted by the council. And this RCI or the council sponsored training courses are being adopted from time to time depending on upon the need. With time, the needs change and they adopt these RCI courses. Other
Ma'am, I have a doubt
qualifications.
here.
Hmm. Tell me.
Ma'am, regarding this RCI, is it
Hmm.
like mandatory for the counseling thing? Like suppose tomorrow we finish
That's
the
it.
course,
Ha, ha.
we are supposed to go
The if you
to
are
the.
going to open a clinic or start any clinic, you should have this RCI
Okay.
certification.
Okay. And second thing, ma'am, like you said, there are different branches of counseling. So, like,
Hmm.
suppose if with regard to problems like ADHD or autism, we can also be doing the counseling work for them as well, or it
Yes,
is
yes.
specifically covered only for clinical psychologists.
No, you can give them also counseling.
Okay, ma'am.
Then coming to the next unit, this is that was your first unit. Now coming to the second unit, that is process of counseling. Under this, we will be discussing the what are the steps and stages of counseling, and here we will be discussing developing a relationship, working in a relationship, and terminating a relationship. So these are the three main steps in any counseling relationship. The next is the factors that influence the counseling process. Much is written in this chapter, but the main thrust is about developing a counseling relationship. Different things are written here. So if we go on studying all these things, it will take time. So the basic step in counseling involves gaining recognition for the skills and experiences being confronted from a caring person by the way they used to discount themselves and others re-experiencing. These are the main steps and stages. Is first we have to identify what is the problem or what are the issues, or is there a need for counseling. Suppose someone has come to you with a very silly thing, whether that is actual, that whether that person actually needs counseling or not, that is done at this stage of identifying the need. Then we prepare for the counseling, then counseling is conducted and follow up is taken. This is another form of discussing the stages of the counseling. So how the counselor, or first steps the counselor follows. The counselor first takes the background information of the client, then identifies whether what is the issue, or for what the client has come to me, whether I am an expert in marital counseling. If I am not an expert in marital counseling, it's ethical to send or to refer my client to some marital counselor. If my client has come with some drug abuse or drug dependency issues, if I am not an expert in this drug abuse counseling, I should refer my client to some other counselor. So once I realize that I can handle this issue, I should formulate the case. I should record for the issues of my client and start the counseling process. So in the first step in counseling process is goal setting for the therapeutic process, as it is written. I should set my goals for this specific client. My client is unable to concentrate in his or studies. He is disturbed or he is being engaged. He is involved with so many girls or with so many girlfriends. That's why he is not able to concentrate in his studies, and he is not able to focus in his study and give time to his studies. That's why my client has come to me. So once I realize that this is actually a problem, I should set goals for my client. These are the things that my client should do. My client should understand. My client should think whether କ'ଣ କରିବ ପିଲେ ଏମିତିଆ କେସ୍ରେ. Suppose someone is come with this issue, as I said, my client has a number of girlfriends and he is spending much time with them. He cannot give time to his studies and he cannot concentrate on his studies. ତ କେମିତିଆ କରିବ? ଟିକେ କୁହ, ବହୁତ ଗୁଡ଼ା ମୁଁ କହିଲିଣି, ମତେ ଥକା ଲାଗିଲାଣି. Or you yourself formulate a question. You yourself formulate a case. Tell me a case and how you will be proceeding in the counseling process. କେତେ ଜଣ ଅଛ ସମସ୍ତେ ଗୋଟେ ଗୋଟେ ମତେ କୁହ case. Take a simple case. 9 people are there. ସମସ୍ତେ ଗୋଟେ ଗୋଟେ କୁହ so that we can proceed in this. ଦେବସ୍ମିତା
Yes, ma'am.
କୁହ ଗୋଟେ. ଦିବ୍ୟା ଗୁପ୍ତା, ଜଗନ୍ନାଥ କୁଆର.
Ma'am, like especially in today's generation where we are going through, maybe we take the case of a adolescent struggling between his teenage years and the other distractions and academic pressure which he has. So the parents come to a conclusion that they are unable to handle him at home. So maybe they take the help of a counselor, where we can have a intervention of giving him both emotional and counseling session relating to mental well-being and also a career-oriented approach. I mean, both the ways. So our role could be intervening with the help of understanding the background of the child, the role of the parents, the emotional state of the mind. Like some students are, or some kids are very extrovert, they can express themselves, whereas some are very introvert. They need a a second, they need someone to hear to them patiently, and parents are both working, so it becomes a kind of a very tough situation today for both parents and kids to manage the kind of things going on. So like suppose
Okay. Rest of you, please think of a issue or a case so that we can discuss this in light of that case. Give me 5 minutes break or 3 minutes break. Okay, are you there?
Yes,
So,
ma'am.
any new case? I think only one of you is listening. Hmm? Others,
मैडम
Rupali does? हाँ.
मैडम
हाँ.
हाँ, एक और ये प्रॉब्लम है कि हम लोग सोशली कनेक्टेड नहीं हो पा रहे हैं, और
हम्म.
न्यूक्लियर फैमिली इसका एक रीजन है मैडम, कि कोई एल्डर लोग हमारे साथ नहीं रह रहे हैं, तो वहां पर कम्युनिकेशन के चलते
नहीं नहीं नहीं
इमेज
नहीं, वो ये सभी प्रॉब्लम का मैंने सब मैं पूछ रही हूँ, आप ऐसा एक प्रॉब्लम बताओ जो आपके क्लाइंट आपके पास लेके आया है। ये सभी रीजंस हो सकता है आपके क्लाइंट का जो प्रॉब्लम फेस करे। एक प्रॉब्लम बताओ जो आपके क्लाइंट आपके पास लेके आया है। मनीषा रानी
मैम
please.
मैम
नमस्कार।
यस मैम।
हाँ, मनीषा कही दियंतु आउ जने कहबो। हाँ.
मैम आजकल जो अभी रिसेंट चल रहा है बच्चों के एग्जाम्स प्रेशर्स,
हम्म.
जिसके लिए बच्चे काफी ज्यादा स्ट्रेस पे रहते हैं, उनको काफी ज्यादा नेगेटिव थॉट्स आते हैं, तो उसको हम लोग पहले आइडेंटिफाई कर सकते हैं उनके नेगेटिव
नहीं, क्या
थॉट्स क्यों आ रहे हैं।
आपका क्लाइंट क्या प्रॉब्लम लेके आया है आपके पास, बस उतना
क्यों
ही बता।
एग्जाम एग्जाम का मतलब काफी ज्यादा प्रेशर है, नेगेटिव फीलिंग आ रहा है, पढ़ नहीं
उसको
पा रहा है वो।
एंजाइटी हो रहा है, वो सो नहीं पा रहा है, ठीक से खाना नहीं खा पा रहा है, वो एग्जाम के लिए उसको डर लग रहा है।
जी,
ठीक है,
वो एग्जाम लिखने के लिए भी उसको भी डर लग
ठीक
रहा
है,
है।
ठीक है, ठीक
तो
है। हाँ,
हम लोग
तभी आप
उसको सजेस्ट कर
आगे
सकते
बात
हैं कि
आगे आगे पढ़ते हुए थोड़ा थोड़ा बात करेंगे।
जी
हाँ, हाँ, ठीक है।
जी
और
मैम।
जगन्नाथ कुंवर कुहतु किसी गोटे कहते जगन्नाथ कुंवर।
Yes, ma'am. As I am Jagannath from Keonjhar, ma'am.
हम्म.
Exactly, I'm talking about the problem situation like some employee struggling with workplace stress, ma'am. And it's the recent trend we are having that type of problem, and most of the peoples, especially the female, means
हम्म. हम्म.
are facing workplace stress, ma'am. So
वर्क
for
लाइफ
that,
बैलेंस ସେମାନେ
हाँ,
वर्क लाइफ
work-life
बैलेंस
balance.
କରିପାରୁନାହାନ୍ତି।
No,
हाँ.
yes, ma'am. Means exactly workplace stress. I'm talking about workplace stress, ma'am. That means for that, especially we have to identify exactly what type of stress the
ନାଇଁ,
client is
ମୁଁ
having.
ମୁଁ ପଚାରୁଛି ଆପଣଙ୍କର କ୍ଲାଏଣ୍ଟ ଆପଣଙ୍କ ପାଖକୁ କଣଟା ପ୍ରୋବ୍ଲେମ ନେଇକି ଆସିଲା?
Problem
ସେ
is means she is facing stress while he was in the workplace.
ତାକୁ ଅଫିସରେ ଭଲ ଲାଗୁନି, ଆଉ ସେ
Again,
ଅଫିସ ଆସିବା ପାଇଁ ଆଭଏଡ କରୁଛି। ତାକୁ
yes,
ମନ
yes,
ହଉଛି
yes.
ମୁଁ ଛୁଟି ନେଇ ଯାଇଥାନ୍ତି, ମୁଁ ଘରେ ରହିଥାନ୍ତି।
Or otherwise I will leave means give my
I
resignation.
should resign from my job. I am
Yes,
not
yes,
feeling comfortable in my job, and
yes,
actually I am not contributing as expected from my boss। ଏଇଆ ସବୁ ତା ମନରେ ଆସୁଛି, ସେଇଥିପାଇଁ
yes, yes,
କିଛି
ma'am. And
or I am
sometimes,
ହୁଁ,
yes, ma'am. Sometimes she feels like that means is some lacuna inside me, or means she is depressed now. That stress
okay,
taking
okay,
her.
हाँ हाँ हाँ, that much।
Yes, that's
ଦେବସ୍ମିତା,
why.
हाँ, ଅନୁକ୍ଷା ମହାରାଣା, ଦିବ୍ୟା ଗୁପ୍ତା, ଫଟାଫଟ ଟିକେ କହିଦିଅ କଣ ପ୍ରୋବ୍ଲେମ ଯାହା ଜାଣିପାରୁଛ ଗୋଟେ। ଓକେ, नो
मैम
प्रॉब्लम।
अल्कोहल एडिक्टेड ପାଇଁ ସେ problem face
Someone is addicted, huh? So your somebody has come with, or the parents have come with their children who is addicted, alcohol addict। एया तो सीता। अनुष्का।
अल्कोहल
Hmm. Okay, we will take up a single case. So background information. Suppose take the example of the student who is having examination anxiety or examination fear. We'll take that case. So first we will discuss with the student, or we'll take information about the student, about the background. How he had performed, what is his achievement during the last 2 3 years, whether he or she is going to any tuition, how much pressure or what is the expectation of the parents. As a counselor, we should know that a child faces this type of anxiety in case there is the expectation from the parents is too high। ସେମିତିଆ କେସ୍ରେ ହିଁ ଆମର କ୍ଲାଏଣ୍ଟ ଏତେ ଷ୍ଟ୍ରେସ୍ଡ ଫିଲ୍ करे ନା। ଆମର କ୍ଲାଏଣ୍ଟ ହିଁ ନିଜେ ସେ ଷ୍ଟୁଡେଣ୍ଟ, ଆମର କ୍ଲାଏଣ୍ଟ ଇଜ ସପୋଜ ସେ ଅନିଲ, अनिल कौन निजे ही एते एक्सपेक्टेशन निज पाई के हाई रखी कि जेति सी या फेस करुची सो फर्स्ट वी कलेक्ट ऑल द इंफॉर्मेशन बैकग्राउंड ना टीचर्स मान को एक्सपेक्टेशन अच्छी ना ही इज नॉट गेटिंग मच टाइम टू स्टडी ना ता पाखरे स्टडी में once we collect this all these background informations and we realize that this is actually a problem से ये गध पिला पाठ तक किसी पढ़ी नाही सेइथिपाई तार एग्जाम पाई एंजाइटी होची so within a session we can wind up the case we there is actually no issue to give counseling to the subject तू तो पाठ पढ़नु तो टेंशन हबो ही so there is not much to do ताकू पाठ पढ़िया ପାଇଁ कि केमिति सेही पटे गाइडेंस देकी ताकू क्लोज करिबा suppose the student has given all his effort he is actually interested he wants to get good mark he has performed well in the last 2-3 years in that case we can formulate a case that actually my subject my client is facing some type of issues and that should be addressed through the process of counseling so for this we have to set goal he feels that he is not giving much effort towards his studies तो सेइथिरे ता ପାଇଁ गोटे टाइम टेबल तैयारी करा जाय परिबो जोटा को से फॉलो करिवो जहा करिवो देन once the timetable is given to him he should be encouraged to follow the timetable the parents मान को expectation high होची तो सेई केस रे one of the goals should be that the parents should be counseled they should be given the counseling first not to put pressure on the child एया होची गोटे काउंसलिंग रो प्रोसेस देन इवैल्यूएशन एंड इंटरवेंशन जो जहा हेला परीक्षा पूर्वरु ताकू इवैल्यूएट करबा जे वेदर माय क्लाइंट हैज ओवरकम हिज फियर फॉर एग्जाम और नॉट and whether any further intervention is required or can we close the case so once the initial interview is done in that state or in that situation the counselor either take 3 of these decision no further counseling is required as I said मोर तो क्लाइंट पाठ ही पढ़ी नाही से पाठ जदि पढ़ी नाही परीक्षा 2 मास रहिला ताकू छानिया मानिया लागुची से खाई पारुनी सोई पारुनी बस पारुनी से सब करि पारुनी एसो एंजाइटी हबो पाठ न पढ़िले सो गोटिए काउंसलिंग सेशन ने याकू ये करिया फर्दर अपॉइंटमेंट इज रिक्वायर्ड अरे मोर क्लाइंट तो गोटे ब्राइट पिला ताकू आगो को जिबा को अछि सो आई शुड गिव फर्दर अपॉइंटमेंट and should further talk on these issues and try to resolve the issues or try to reduce the tension of my or anxiety of my client and if any alternative service is required मु देखिली मोर क्लाइंट रो मैथ्स पाई कि ही बहुत भय अछि सी जो मैथ्स ट्यूशन को पाकू ट्यूशन जाउची से सर को सहित ट्यूशन सी भलो पढ़ी पारु नाही सो आई वुड सजेस्ट his parents to give tuition to a person I know or a person they know with whom he or she will be comfortable there is much time आउरी परीक्षा पई 2 मास अछि this can be done so एटा होची गोटे process of counseling then next is the length of the treatment depends upon केते दिन धरि के काउंसलिंग गोटे सेशन ना 2 सेशन ना कोन केते दिन लागिवो so it depends upon the severity of the problem the motivation the response of the client mo client kete respond karuchi moro instruction ku that also determines this the type of the problem ta mu tamu कहली client पाठ ही पढ़नी so there is no problem client सी किंतु पाठ पढ़िबो से दिगरे चिंता करा जाऊ सेठी कोठी मेंटल इश्यू किछि नाही सी निजे ही एफर्ट देई नाही सो दैट इज एटा को आमे किछि जे एफर्ट देइछि सेपटे पेरेंटल प्रेशर अछि सेपटे टीचर रो प्रेशर अछि सो दैट इश्यू इज very complicated in that case much time is spent on the counseling process age of the client जदि matured अछि intelligent अछि सी बुझिया पाई कि से कन्विंस्ड हेई पारनी से केस रे बहुत समय धरि कि काउंसलिंग लागिबो more focused and limited the problem being addressed जदि प्रॉब्लम टा मोर फोकस्ड है कि सेटा को प्रॉब्लम टा को हमें डील करचंती कम टाइम लागिवो more the treatment addresses healing emotional injuries longer जदि the case or the client has come with some emotional turmoil emotional pain that will definitely take much time compared to ei jo practical problem guda ka ame कहउछंती procedure in the counseling process these are the steps बहुत समय ही जाउछि पिला माने एटा देखि दियो सेफ ट्रस्टिंग एनवायरनमेंट थिबो help the person put the concern into words. Unless until your client explains his problem in words, we cannot do anything. As a counselor you cannot do anything unless until तमर client आसिला तार non verbal cue रे सी तार दुख आखिरु खाली लुह बुहाई चलिला. You cannot understand what is actually going within your client. You cannot help the client. So that must be translated into words, that must be converted into words. Active listening जोथिरा that active listening also include paraphrasing, summarizing, reflect and interpret, and focus on the feeling, not on the event, because we are dealing with the mono of our client. Moro client ro mono emiti kashto hochi tar mono. That's why it should not simply focus on events are the things that expresses how much my client is in pain. So the events are just an indicator. आमको जो ज्वर होची, ज्वर is not a disease. Jara is actually an indicator that we are suffering from some type of infection, some type of mm, uh, maladjustment has taken within our body. That's why we are experiencing jara. Similarly, se jo event re mate eya lagila seya lagila amar jo client kochi, that is simply a reflection of the pain he is or she is going through. And the client, the counselor should know paraphrasing, summarizing, reply. Then transfer problem statement into goal statement. So ये जो प्रोसेस रा आउ गोटे इम्पोर्टेंट जिनस होची, द काउंसलर शुड नो हाउ टू कन्वर्ट दिस प्रॉब्लम्स इनटू गोल स्टेटमेंट. मु तमने कहिलो मैडम ए सब कहिलो, मु तमने कोची नै तमे माने प्रॉब्लम क्लाइंट रा प्रॉब्लम को फोकस करिकि को जोटा को मु ट्रांसलेट करिकि गोटे गोल टे करिकि तमु देखेबी जे एइटा को हमें केमिति प्रोसीड करिबा. जेमति जणे कहिला जे नाइ तारा पेरेंट सहित मिसी के आसिले सी ड्रग एडिक्ट की अल्कोहल एडिक्ट हे गलेनी, ताहले अल्कोहल एडिक्ट हे जंती आजिकाली प्रॉब्लम बहुत अल्कोहल एडिक्ट होचंती. सेटार किछि हमर काउंसलर हिसाब रे हमर किछि काम नाही. हम पाक जेतल जे आसीबो जे मोर ए प्रॉब्लम हैला हमें ता जेतल जाई कि ता सहित कथार्ता हबा. दुनिया रे एया हेले से हेले हमें किछि करि परिबानी. सो सेही प्रॉब्लम टाकू ट्रांसलेट करि पारुथिबो गोटे गोल को. Then explore possible approaches to goal. The goal, that means the goals should be attainable. Ame emitia goal theory kariba as a counselor that we can reach at the goal or we can attain the goal. Help the person choose one way towards goal. Ta ei jo goal guda ko attainable bhi heitibo, and that should our clients should also be able to reach at the goal. Make a contract to fulfill the plan. मु मोर गोल करिबी, मु मोर प्लान करिबी, मु मोर टाइम टेबल करिकि मो क्लाइंट को देबी, बापा तते टेंशन होछि कि एग्जाम एंजाइटी होछि कि नै नै एउडा करिबू. देखला बेलकु मोर क्लाइंट से सब किछि फॉलो करनी, सी खाली तार मूर्छा होछि घड़ी घड़ी को मूर्छा होछि उठुछि, मूर्छा होछि उठुछि. ता बापा मां भी हम पिला परीक्षा दबो कहि ता सहित मिसी कि मूर्छा होछंती. So there is, I am actually a worthless counselor. I am not efficient counselor. I should make sure that the goal I have set, and I will not actually set the goal. The goal should be set by the counselor and the client should agree that he or she will be following the goals. Because counseling is not a process of direction, it is not a process of ordering. It is the level is same. Both the counselor and client both are in the same level. So they should combinedly make these goals, plans, and the goals should always be attainable by the client and the counselor should, here it is written, make a contract to fulfill the plan. That means the counselor should follow up or he should ascertain that the plans are being meet. The client is actually following the plan. Summarize what has occurred, get feedback information. The counselor may also employ a variety of technique to help the client understand their feeling. Counseling is a process. It is guided by theory. The theories we will be discussing later. The process of counseling is dynamic in nature. So these stages, as I said, in the starting of this unit, there are three stages: developing a relationship, working in the relationship, and terminating. How to develop a relationship? So because counseling is a relationship of trust, faith, where the client is disclosing the ankuha kathas, the things he has never shared with anyone. He shares this with the counselor. That's why it should be built upon trust. So developing relationship itself is an important phase in counseling. If you are getting a question on the stages of counseling, the first stage is developing a relationship. So in order to develop this positive helping relationship, the counselor has to connect with the client. The client should feel that if I say something that will be understood by my counselor will definitely understand me empathetically, without making any judgment. My counselor will understand me. So early stages of counseling relationship afford chance to build counselor, understand the client and issues faced by the client. So laying the foundation of trust, establishing the structure and form relationship will take. Informed consent process is also there, articulating the role of the client and the counselor. So, getting to know you, developing rapport, and building trust create core condition necessary for counseling. How to develop rapport? This is by predictability and consistency. The counselor, how to show this predictability and consistency? Suppose the counselor fixes a date for the next meeting, but he doesn't turn up. Then it shows that the counselor is not predictable and he is not trustworthy. So he should show these qualities, this trait while developing the rapport, or these are the things that are of prime importance during the process of developing rapport. Then next is testing. Suppose you are sharing something with your counselor and you find that your counselor says or discusses it with others. So in this situation, how we test our counselor? We say something actually false, or that is not actually true about me. I will try to disclose it with my counselor, and I can test whether my counselor is discussing it with others or not. In the present generation, it's so smart that they want to test everything and anything. ଯେମିତି ଗାଡ଼ିର ଟେଷ୍ଟ ଡ୍ରାଇଭ୍ ନହେଲେ ଆମେ ଗାଡ଼ିଟା କିଣୁନାହାନ୍ତି, ସେମିତି ଗୋଟେ କାଉନସିଲର ପାଖରେ ବି ଆଜିକାଲି ଜେନେରେସନ ପିଲା ଦେ ୱାଣ୍ଟ ଟୁ ଟେଷ୍ଟ the trustworthiness of the counselor. So while building rapport, that factor should be taken care of. Establish confidentiality. ଯେ ମୁଁ ମୋର କ୍ଲାଏଣ୍ଟ ଯାହା କହିଲା ତାକୁ ଅନ୍ୟମାନଙ୍କ ସହିତ ସେୟାର କରିବି ନାହିଁ. So once this is the first stage and going to the next stage. ଏତିକି ସବୁ ହେଇସାରିଲା ପରେ ଆମେ ନେକ୍ସଟ ଷ୍ଟେଜକୁ ଯାଉଛନ୍ତି ରାପୋ ବିଲ୍ଡିଂରେ, ଯୋଉଥିରେ କି ଗୋଲଟା ସେଟ୍ କରାହେଉଛି. And core condition necessary for successful counseling is empathetic understanding. Counselors should empathetically understand the client's issues, the problems, the pain of the client. Unconditional positive regard. You must note down this term. Unconditional positive regard means considering the client as a person or as a worthy person and is separate from actions. ତାକୁ ସେଇ ଲୋକକୁ unconditionally we are showing them positive regard. ତାକୁ ଆମେ ସେତିକି ଭ୍ୟାଲ୍ୟୁ କରିବା ଦରକାର, ନହେଲେ କ୍ଲାଏଣ୍ଟର କ'ଣ ଦରକାର ସିଏ ଆସିକି ମୋ ପାଖରେ ବେଇଜ୍ଜତ ହବ, ମୋ ଠାରୁ ଦି ଚାରିଟା କଥା ଶୁଣିବା ପାଇଁ ତାର କିଛି ଆବଶ୍ୟକତା ନାହିଁ, ସିଏ ଆସିବ ହିଁ ନାହିଁ. Congruence means showing genuine self in the client interaction. କ୍ଲାଏଣ୍ଟର ସହିତ ଇଣ୍ଟରାକ୍ସନ କଲା ବେଳକୁ I should be genuine myself. Then respect. जो मो क्लाइंट को सेतिकी मु रेस्पेक्ट, because my client has come to me with his or her problem, I should not disrespect my client. Confrontation, it promotes realistic and accurate view. The counselor should use this confrontation ସବୁ ଯାହା client positive unconditional positive regard ଆଉ ଆରଟା ଯୋଉଟା କହିଲି ମୁଁ କଣଟାରେ ପିଲେ non judgmental ସେଇଆ ହବାର ଅର୍ଥ ନୁହଁ ଯେ the counselor will never help the client to confront to the reality. The next is immediacy, consideration of the problem with here and now attitude. Then concreteness, paying attention on what is practical in the process. Self disclosure, promoting positive perception and appropriate focus. The next step is working in a relationship. How to work in a relationship? This occurs after the client and counselor have developed a good rapport, or they have developed a good relationship, and they have developed possible goals towards which they will work together. ଏଇଥିରେ ଏଇଆ ନୁହଁ ଯେ କାଉନ୍ସିଲର ଗୋଲ ସେଟ୍ କରିକି କ୍ଲାଏଣ୍ଟକୁ ଦେଇଦବ. Actually he goes hand in hand with the client to reach at the goal. Once trust has been established, the relationship moves to the second or next stage. So in this case, while working, there should be a changing of perception. Client often come to the counselor as a least or the last resort when they think that the situation is not only serious but hopeless. That means the client is not able to help himself. The situation is hopeless. The client is helpless. The counselor can help the client change the distorted, unrealistic perception by offering them an opportunity to explore his thoughts within a safe, accepting, and in a non-judgmental atmosphere. କ୍ଲାଏଣ୍ଟ କେବେ ବି ନିଜେ ନିଜେ ଆଉ କଣ ଟିକେ ହେଲା ମାନେ ଦୌଡ଼ିକି ଆସେ ନାହିଁ କାଉନ୍ସିଲର ପାଖକୁ. ଇଟ୍ ଟେକ୍ସ ମଚ୍ କରେଜ୍. ଶୁଣୁଛ ପିଲାମାନେ ସମସ୍ତେ? ଆଉ
Yes,
କିଏ
ma'am.
ଜଏନ୍ କଲେଣି? ଜନ୍ମ ଜ୍ୟୋତି ବେହେରା କଣ ବୋଧେ?
Yes, ma'am.
ଡେରିରେ ବହୁତ ଜଏନ୍ କଲ. ହଉ ଠିକ ଅଛି.
Madam,
Then
ମୁଁ
କଣ
ଭୁଲି ଯାଇଥିଲି.
ହଁ 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 ହଉ ଠିକ ଅଛି. କଣ ହେଲା ପିଲେ, କଣ କହୁଥିଲି? ସିଏ ଆସିବନି. So when the client comes to the counselor, he comes with a distorted, unrealistic perception about himself and about the world. ମୁଁ 10th ରେ ଯୋଉ ପ୍ରୋବ୍ଲେମ ଜଣେ କହିଲ ଏକ୍ସାମ ଏଂଜାଇଟି, ମୁଁ 10th ରେ ଯଦି 98% ମାର୍କ ନ ରଖିଲି ମୋର ଜୀବନଟା ପୁରା ନଷ୍ଟ ହେଇଯିବ. Then I should get 98, 99%. That is actually an unrealistic belief, unrealistic perception about the exam, about the results. So that is actually creating stress, anxiety within the client or within the boy. That's why he has come for this counseling. Seithire counselor should help the client in changing perception by setting 98 mark न रखि 98% न रखिले भी एमती किसी असुविधा नहीं, because you are that much talented, you can secure 98% of mark. ସେଇଥିପାଇଁ ସେୟା ଭାବୁଛୁ, and you will definitely secure that much. କାହିଁକି ରଖିପାରିବୁନୁ ତୁ ଭାବୁଛୁ କଣ ପାଇଁକି? ନା ଏଇଆ ଏଇଆ ତୁ କରୁନୁ, ତାହେଲେ ଠିକ ଅଛି, ଯେ ସେୟା ସେୟା କରୁନୁ ସେୟା ସେୟା ସବୁ ଆମେ କରିବା. ତାକୁ ରିଏଲାଇଜ କରିବାକୁ ପଡିବ ଯେ 98% is not actually the only standard or only thing in this world. ଯଦି ନ ରଖିପାରିଲୁ, ଆଚ୍ଛା ତୁ ଯଦି ଏମିତି ଟେନସନ ଆଂଜାଇଟି ରହିବୁ ତାହେଲେ ତ କିଛି ବି ମାର୍କ ରଖିପାରିବୁନୁ. ତୁ ତ ପରୀକ୍ଷାର କ୍ୱେଶ୍ଚିନ୍ ପାଇଲେ କିଛି ବି ଲେଖିପାରିବୁନୁ. ଦେନ୍ ହ୍ୱାଟ ୱିଲ୍ ହ୍ୟାପେନ୍? ତାକୁ ଅପୋଜିଟ ସାଇଡଟା ଦେଖେଇକି ତାକୁ ଆମେ ରିଏଲାଇଜ କରିବାକୁ ପଡିବ. ହ୍ୱାଟ ଏଭର ୟୁ ଆର୍ ଥିଙ୍କିଂ ଇଜ not normal. You are exaggerating everything. Your thought process is distorted. So you should change this thought process, this distorted, this complicated thought process, this unrealistic thought process actually putting you in trouble or creating stress. The next is leading. Changing the client's perception requires high degree of persuasive skill and some direction from the. अच्छा तू जो रखिबा 98% टा ही गोटे जिनस दुनिया रे कि आउ किछि नाही कि एउडा कोन ताको कहितेले एमति सुनिबो कि से केबे भी सुनिबो नाही. There are the client, the counselor requires a high degree of persuasive skills to change the client's perception. That is done during the वर्किंग फेज वर्किंग विथ रिलेशनशिप जोटा आम सेकेंड फेज टा पढ़ुचंती सेटा देन एक्यूरेट एम्पैथी एम्पैथी इज द काउंसलर्स व्हाट इज एम्पैथी you may get a short note or short question empathy is the ability of the counselor to experience the client's world as if it were his own without ever losing the quality of as if बुझीपार एम्पाथी को आम अलग टर्म रे बा सिंपलेस्ट टर्म रे कहले या कहि परिबा जे पुटिंग वन सेल्फ इन अदर्स शू हियर द काउंसलर पुट्स और रियलाइजेस द वर्ल्ड ऑफ द क्लाइंट एज इफ इट इज द वर्ल्ड ऑफ द काउंसलर मु फील करूची जो पिलाटा एग्जाम रे एग्जाम एंजाइटी होची आई फील दैट से पिलाटार को केते कष्ट होथबो तार जो एग्जाम एंजाइटी होची ताको केते या कष्ट होथबो से केमिति भाबुथबो से तो सेति पई खाइ पारनी ताकू ता वर्ल्ड तार जो भावनाटा को मोर भावना बोली मु जो भाबिबी दैट इज कॉल्ड एम्पैथी बट एट द सेम टाइम आई शुड नॉट लूज दिस क्वालिटी और दिस कॉन्सेप्ट ऑफ एजिव मु तो जदि भाबिबी जे नाइ ता वर्ल्डटा मोर ताले मु भी मोर खिया पिया छाड़ी की तापरिया मु राति रे सकाळ रे मूर्छा भी बारंबार बही देखि देखि की मु सेई समय रे रियलाइज करिया कथा दिस इज एजिव एटा मोर वर्ल्ड सेथिरे मते एमितिया मु जदि थांती ताहले मते केमती लागि थांता मु अच्छी बोली केबे भाबिबा उचित नुह मु जदि ता कथारे ता जगह रे थांती ताले बहुत समय रे हमर सांग माने हमर पेरेंट्स हमर वेल विशर्स कोंते अच्छा तू ताकू जो कहि दउ जो एमती सब कथा तू भाबे तू जदि ता जगह रे थांत कोन तते लागि थांता दैट इज नोन एज बीइंग एम्पैथेटिक टुवर्ड्स द अदर पर्सन है तो सेटा हेतिबा दरकार सो कमिंग while discussing about empathy there are two components of empathy one is empathetic rapport another is competitive communicative attunement empathetic rapport is the accurately sensing and being able to see the client's world the way they do khali empathetic rapport hoji I can understand what he or she I am putting myself in his shoe मु तार जगार रहिले मते ता जगार रही कि मु भाबुची मते कोन लागुची दैट इज एम्पैथेटिक रैपर एटा होची गोटे पार्ट ऑफ एम्पैथी अनदर इज कम्युनिकेटिव अटेनमेंट मु जो फील कली दैट शुड आल्सो बी कम्युनिकेटेड टू माय क्लाइंट मो क्लाइंट जानिबा दरकार जे मु बुझी पारुची ताकू केमिति फील होउची so this is two component of empathy and there are also two types of empathy gote hochi primary empathy gote advanced empathy primary empathy is to respond in such a way that it is apparent to both client and counselor that the counselor has understood the client's major themes empathy advanced empathy hoji helping the client explore the themes issues emotion new to his or her awareness प्राइमरी एम्पैथी रे मु तो कथाटा बुझी पारुची मु तो कष्टटा बुझी पारुची सेटा आउ एडवांस रे एई सब जो जिंस होउची बा तते जो फीलिंग तोर अछि तू जोटा बुझीचू तोर जो डिस्टॉर्टेड थर अछि ताकू तू केमिति एक्सप्लोर करे तो तते जो फीलिंग्स होउची ताकू एक्सप्लोर करे आउ एई जिंस तू जानी ना these are the things you are not actually focusing upon that is said in the advance the next is accurate empathy for next is self disclosure it is an important to let the client know that the counselor as a person self here the counselor self discloses himself or herself mu tamakora counseling pai basichi mu counselor so I should self disclose my myself before you je the self disclosure may be in this form of the counselor's own problem facts about the counselor's role counselor's reaction to the client counselor reaction to the counselor client relationship এটা হচ্ছে in these forms the counselor can self disclose himself then positive regard সেটা হচ্ছে the counselor should express appreciation of the client as an unique and worthwhile person and embrace the client's ethnic self my client or you suppose you are the client I should make you realize or I should show that I have positive regards for you as a person you are valuable as a person you are unique whatever you are thinking is obvious it is normal. As an individual, you have your own thoughts. If it is also a distorted distorted thought or maladaptive behavior, then it is normal. Jaha bhi tame kahucha seita sabu as a person you have every right to think, every right to behave in that way, and I respect you as an individual. That is known as positive regard. Then comes je ei jaha sabu karucha, these are the distorted things, that's why you are experiencing or you are going through this pain, that should be changed. But the counselor should always show positive regard, respect towards the client. Responding style of the client counselor also is important in working phase. Then next is immediacy, jota ame padhithile. Humor bi gote the counselor can use in the process or while working in the counseling relationship, he or she can use humor, but the it must be used with sensitivity and timing. ଜଣେ ଆସିଛି, ତମେ ଜଣେ କହିଲା ଏକ୍ସାମ୍ପଲ ନା, ସେ ଯୋଉ ଫିମେଲ ୱାର୍କର, ସି ଇଜ ଏକ୍ସପିରିଏନ୍ସିଂ ଷ୍ଟ୍ରେସ୍ ବିକଜ ସି ଫିଲ୍ସ ୱାର୍ଥଲେସ୍। ସେଇଥିରେ ସ୍ତ୍ରୀ ଲୋକମାନେ କ'ଣ ସବୁ କଥାରେ ଏମିତି ହେଇଯାଆନ୍ତି ଆଉ, ନାହିଁ କି ଏମିତି କହିକି ଗୋଟେ ଗୋଟେ ଲୁଜ୍ କମେଣ୍ଟ ତାକୁ ଦେବ ନାହିଁ, କିମ୍ବା କୌଣସି ସେନ୍ସିଟିଭ ବା ହଟ୍ କଲା ପରିଆ କୌଣସି ଗୋଟେ ହ୍ୟୁମର କରିଦେବ ନାହିଁ। Then next is confrontation. This is an invitation to the client to look more closely at the behavior that is not working. Your client has come with some issues, some problems, some distorted thoughts, some misconceptions, some maladaptive behavior. So here the counselor makes the client front to front, confronts the clients to the facts, or whatever the client is thinking is not actually realistic, and because of these things you are experiencing, whatever you are thinking, is it correct? And these are the things that are actually hurting you or giving you pain or creating a problem in your relationship, and that is these are the things that interfere in your growth, in your healthy functioning, in your change. So the client is confronted. जोटा तमरो स्टूडेंट रो कथा कहिलो जे बा जोटा तमे कहूच फीमेल वर्कर को कथा, सी कहूची आई कैन नॉट कोप विथ दिस वर्क एनवायरनमेंट, आई एम फीलिंग स्ट्रेस्ड। अच्छा, तमे जो आसुच फीमेल वर्कर बोली कहिकी सबुदिन 10टा बेला टाइम जगह तमे 12टा बेले आसुच, डेफिनेटली योर boss will be dissatisfied with you. Your boss will never accept such type of punctuality you are showing in your office timing. अन्य माने 10टा जगह 10टा 15 हेले जदि बॉस गाड़ी दउचंती, तमे प्रतिदिन तमे तमरो छुआर प्ली नै कि कहूछ जे मु डेरी रे आसुची, इज इट करेक्ट? तो once your client gets the realistic idea that these are the faults that are being committed by me, then he start realizing that it is not the fault with my boss, rather I am committing the mistakes and I should try to be punctual or try to be good in my बिहेवियर। या कहीकि कहब या नुह जे सब बेले क्लाएंट जो आसीबो सी सब बेले भल आ तार चारिपट लोक माने ताकू हैरान करूचंती। इन मेनी केसेस और इन मोस्ट केसेस द क्लाएंट हिमसेल्फ is actually doing the mistake. The next is transference and counter transference, that actually happens in the last stage, that is during the process of counseling the client starts projecting the past or present feeling, attitude and desire onto the counselor, and the client feels as if the counselor is his brother, elder brother, or his father, or some male person he has ever liked, and she tries to transfer his feelings towards that person, the feelings he had towards that person, the feelings he has towards his elder brother, now to the counselor. This is known as transference. And similarly, the counselor also projects emotional reaction or behavior towards the client, that is counter transference. So these two things should be dealt with carefully before terminating any relationship. So this is the last stage. It is the end of the professional relationship with the client. When the session goals have been met, it is a phase of counseling that can determine the success of the previous phases and must be handled skillfully. The formal termination serve these three functions. What are the three functions? The counseling process has been finished. Now it's the end. It's time for the client to face their life challenges, and no more the counselor will be with the client to face his or her life challenges. Now the process is over and you have to face your life single-handedly. Change which have taken place have generalized into normal behavior of the client. मोर क्लाइंट रो बिहेवियर पूरा नॉर्मलसी को आसी जाइछि, जो एबनॉर्मल मालाडेप्टिव बिहेवियर थिला से पूरा नॉर्मल सी को आसी गलानी. द क्लाइंट हैज मैच्योर्ड एंड थिंक्स एंड एक्ट्स मोर इफेक्टिवली एंड इंडिपेंडेंटली. एटा भी हेई परिबो एते से भितरे मैच्योर्ड हेई गलानी. देन टाइमिंग ऑफ टर्मिनेशन सेटा डिफर करछि. देन वन थिंग इज रेजिस्टेंस टू termination. Bele bele there is the counselor or the client, they may not want to end this counseling relationship. This may be because of the feeling about the loss and grief or insecurity of losing the relationship during the process. When as human being, when we start interacting with each other, we develop some type of attachment with each other. And when at the time of termination or at the time of departing, we don't want to get departed, we don't want to end up the relationship. That is we try to maintain the relationship. That is the resistance to relationship. The next is what are the factors that influence the counseling process. So first is the structure. पिला माने कोन सुनुछ बुझी पारुछ ना नाही रे?
Yes, ma'am.
Yes, ma'am.
केते जण पिला छ ना गलणी? तो याकू देखुची मु जानि पारनी.
Achu, ma'am.
अच्छा सुनुछ?
Yes, ma'am.
बुझी पारुछ?
हाँ, madam.
बुझी पारुछ ना कोन मैडम तांकर खाली गडगड होउचंती एमतिया पाठ पाठ गुड़ा सब लागुची. एक्चुअली दिस इज नॉट ऑल पाठ. तबे कोन गोटे काउंसलिंग रिलेशनशिप रे करि परिबो सेटा को कहि कि कहूची मु, जोटा कि पाठ फॉर्म रे लिखा हिची. दिस इज व्हाट यू विल बी डूइंग एज अ काउंसलर. So now the factors रे first होची structure, second होची initiative, third होची setting, fourth होची client qualities, fifth होची counselor qualities. These are the 5 points we will be discussing on factors influencing. If you are getting a question on what are the factors that influence counseling process, एई पांचटा पॉइंट को लिखिबो. सो स्ट्रक्चर कोन हो? स्ट्रक्चर व्हाट इज स्ट्रक्चर? स्ट्रक्चर माने कोन? बिल्डिंग रे स्ट्रक्चर ना कोन? काउंसलिंग रिलेशनशिप रे पुनी कोन स्ट्रक्चर रे पिले? सेथरे कोन स्ट्रक्चर हे परिबो? पूरा पर चार्ज सरी गलानी.
Ma'am, good understanding between the counselor and the client.
नहीं स्ट्रक्चर सुनी पारुछ? स्ट्रक्चर होची how the counseling process will proceed, how this काउंसलिंग रिलेशनशिप टा केमिति प्रोसीड करिवो, कोन कोन सेथिरे ରହିବ କଣ ରହିବନି what are the it is regarding the characteristics conditions. Am I audible? ଶୁଣୁଛ ତ ପିଲେ? ହଁ.
Yes, ma'am.
It is structure is regarding the characteristics, conditions, procedures, and parameters of counseling. It helps in clarifying the counselor-client relationship and gives its direction. It protects the rights, roles, obligations of both counselor and client. So, structure provides throughout all stages of the counseling, but it is especially important at the initial stage. Structure is of greater importance. Structure ଏଇଥିରେ ହଉଛି କେମିତି ଆମର ଦି ଜଣଙ୍କର ରିଲେସନସିପ ଟା ହବ, କେମିତି how we will set up the goals, at what time, how many sessions it will take, what is your fees, if you want to terminate the relationship or the counseling process, how would you inform me? If I am not interested in counseling you, how would I be informing you? Suppose before taking an appointment whether you will be consulted, and if you are deferring any appointment, when will you be informing me? Before how many days or how many hours you will be informing me? What will be the cost of the initial counseling session? What will be the cost of the later counseling session? What you have to do, what you are not expected to do? All these things refers to structure of the counseling relationship. And better the structure, more clearer the structure, the outcome is better. So the structure is one of the factors that influence a successful counseling relationship or successful counseling process. Then coming to initiative माने कौन बुझुच? It is the motivation to change. Counseling जोटा करूचंती आमे just to change the thinking, feeling and behavior of our client. So there is there should be a motivation of our client to change, but not all the clients come on their own. In most of the cases they are referred. ସେଇଥିପାଇଁ କି ଦି ପ୍ରକାର client are very difficult. But जो client they come on their own, they in them the initiative is high, the motivation to change is high, and it is easier for the counselor to conduct the counseling, and the success rate is high. जदि आमर क्लाएंट निजे निजे आसी जाइछंती, but if our client have come by referral or they are forced to enter into this counseling process, then the success rate is very low. So जे जोटा आमे कहउचंती जे गोटे हेले they come on their own or on their own initiative, तो आरो ग्रुप टा होचंती reluctant client आ गोटे resistant client. The reluctant client are the people who have been referred by a third party and is frequently unmotivated to seek help. And the resistant client is one who is not willing to change. तमे जते जहा को दे पिला माने ए जो स्क्रीन देखि पारुछ त?
Yes, ma'am.
Yes, ma'am.
So resistant client होचंती, they are not interested to disclose anything, they are not interested to attend the sessions, they are not even willing to bring about change in themselves, in their thought process, in their emotions, in their behavior. So it is very difficult to deal with these type of people. So the initiative of the client is also one of the major factors in the counseling process, and there are several ways in which the counselor can help this client to win this battle. एगुड़ाक विभिन्न techniques गुड़ाक देइछि. Then next is setting. जो counseling should take, as it is a professional relationship, it should take up or it should be done in a professional setup. एमिति नुह जे रास्ता रे घाट रे, and some say that it can also be done in a crowded place also. ଯେମିତି ସଭା ମଧ୍ୟ ବ୍ରହ୍ମଜ୍ଞାନ ପରିଆ କାଉନସିଲିଂ କରା ବି ଯାଇପାରିବ ବୋଲି କୁହନ୍ତି, but as a professional relationship it must take place in a specified and a prescribed setting. ସେଇଟା କେମିତିଆ ହେଇଥିବା ଦରକାର, the room should be calm, the color of the room should be light. ଗୋଟେ ଭଡକିଲା କଲର ଏପଟେ ଗୋଟେ ଯୋଉ ୱାଲ ପେଣ୍ଟିଂ ରେ ଛାପ 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 ଲଗା ହଉଛି ସେମିତିଆ ରୁମ୍ ହେଇଥିବ ମାନେ ସେ କ୍ଲାଏଣ୍ଟ ସିଆଡେ ତାର ଆଟେନସନ ପଳେଇବ, ସିଏ କହିବନି। the room should be calm, light should be dim, not too dim that କି କ୍ଲାଏଣ୍ଟ ସେ ଭିତରେ ପଶିଗଲା ପରେ ଶୋଇ ପଡିବ, ସେମିତିଆ ବି ଡିମ୍ ହେଇନଥିବ, ଆଉ ଏତେ ବି ବ୍ରାଇଟ୍ ଲାଇଟ୍ ହେଇନଥିବ ଯେ ସେ କ୍ଲାଏଣ୍ଟକୁ ସେ ଦେଖିକି ତାର କ'ଣ ଫୋକସ୍ ଅଛି, ତାର କ'ଣ ଇସ୍ୟୁ ସହିତ ଅଛି ସେ ଭୁଲି ଯାଇକି ସେ ଲାଇଟ୍ ସହିତ ଆଡଜଷ୍ଟ କରିବାକୁ ଚେଷ୍ଟା କରୁଥିବ। ଦେयर ସୁଡ୍ ବି ଏ ସୁଦିଂ ମ୍ୟୁଜିକ୍, ସେ ମ୍ୟୁଜିକଟା ବି ଏମିତିଆ ହେଇନଥିବ ତାକୁ ଦୁଃଖ ମନେ ପକେଇ ଦଉଥିବ, ସେମିତିଆ ବି ହେଇନଥିବ। and the room should not be decorated with paintings which are emotion provoking। ଗୋଟେ କ'ଣ ଦ୍ରୌପଦୀଙ୍କ ବସ୍ତ୍ର ହରଣର ଚିତ୍ର ଥିବ, ଏପଟ ଗୋଟେ ସ୍ତ୍ରୀ ଲୋକ ରେପ୍ ଭିକ୍ଟିମ୍ ଆସିଥିବ କାଉନସିଲିଂ ପାଇଁ, ସିଏ ଦ୍ରୌପଦୀଙ୍କର ବସ୍ତ୍ର ହରଣ ଚିତ୍ରଟା ଦେଖିଦବ ସେ ରୁମରେ, ଆଉ ସିଏ ତାର କ'ଣ ତାର ପ୍ରୋବ୍ଲେମ ବିଷୟରେ କହିବ, ସିଏ ସେ କାଉନସିଲିଂ ରୁମରୁ କେମିତି ବାହାରିବି ସିଏ ଆଉ ବାଟ ପାଇବ ନାହିଁ। so some neutral, some pictures of flower scenery that are not actually emotion provoking may be hanged in the room to improve the decoration of the room। ତା ସହିତ the temperature should be good, ତାପରେ ତା room should be quiet। ସେଇଠି ମୁଁ କାଉନସିଲିଂ କରୁଛି ତ କ୍ଲାଏଣ୍ଟ ଆଉ କାଉନସିଲର ବସିଛନ୍ତି, ଘଡ଼ି ଘଡ଼ିକୁ ସିଏ ଆସିକି ପଶିଲାଣି, ଇଏ ଆସିକି ପ୍ରଶ୍ନ ପଚାରିଲାଣି, ସେଇଟା ରେଜିଷ୍ଟର କୋଉଠି ରହିଲା, ଝାଡୁ କୋଉଠି ରହିଲା, କେତେବେଳେ କ୍ଲାସ୍, that should not be the trend। the room should be quiet, comfortable। ଛୋଟ ଛୁଆ ପାଇଁ କାଉନସିଲିଂ ରୁମ୍ ଯଦି ହେଇଛି ତା ପାଇଁ enough toy material ଥିବ, जो चेयर रे बसिबो क्लाइंट दैट शुड बी कंफर्टेबल, से चेयर काउंसलर क्लाइंट रो चेयर रो डिस्टेंस भी गोटे मेंटेन हे कि रहउथिबो। से ए प्रकार जदी दे आर ऑफ डिफरेंट जेंडर, क्लाइंट हेथिबो फीमेल, काउंसलर मेल हेथिबो, ताहले देयर शुड बी सम टाइप ऑफ बैरियर लाइक टेबल ते रहिथिबा दरकार दीटा चेयर मझी रे, जहा द्वारा कि द क्लाइंट शुड फील कंफर्टेबल दैट सम बैरियर इज देयर। जदि दी जण गोटे जेंडर रहिथिबे से बैरियरटार आवश्यकता हेई पारे बा न हेई पारे, बट इन दोस केसेस दैट शुड आल्सो बी टेकन केयर ऑफ। आउ दीज आर द थिंग्स। सिटिंग अरेंजमेंट भी केमितिया हेइथिबा दरकार, 90 डिग्री हेइथिबो ना 45 डिग्री एंगल रे बसिबो ना कोन, सेटा भी ताकू डिसाइड करा जिवो को प्रकार एंगल रे बसिबो। ता छडा द बिहेवियर शोन बाय द काउंसिलर, एटा को सोलर कहि कि गोटे एक्रोनिम करा जायछि। सोलर होची फेस द क्लाइंट स्क्वायरली, द काउंसिलर शुड फेस द क्लाइंट स्क्वायरली, adopt an open posture while discussing with the client। मु हाथ गोड़ जोड़ी कि हाथ दीटा को फोल्ड करिकी बसिकी तम कथा सुनिबी, हाउ विल यू फील। मु जदी गोटे स्ट्रेट पोस्चर रखिकी तम सहित कथार्ता हेकी तम कथा सुनुची, हाउ वुड यू फील। देन L, lean towards him or her। क्लाइंट जेतବେଳେ କହୁଛି ତମେ ଗୋଟେ ଆଉଜି ପଡିଲା ପରିଆ ଚେୟାର ର ପୋସ୍ଚର ରେ ବସିକି କାଉନସିଲର ଯଦି କଥା ଶୁଣିବ କେବେ ବି କ୍ଲାଇଣ୍ଟ କୁ ଭଲ ଲାଗିବନି। ସୋ ହି ସୁଡ୍ ଶୋ ସମ୍ ସର୍ଟ ଅଫ ଲିନିଂ ଟୁୱାର୍ଡସ୍ ଦ କ୍ଲାଇଣ୍ଟ। ଲିନ୍ ଏମିତିଆ ନୁହଁ ଯେ ଯାଇକି କ୍ଲାଇଣ୍ଟ ଉପରେ ହିଁ ପଡିଯିବ, ଟିକେ ଲିନିଂ ପୋସ୍ଚର ରହିଥିବ ଯେ ହଁ ମୁଁ ତମ କଥା ଶୁଣୁଛି। whenever someone leans his or her head towards us, we feel that he or she is actually listening to us। तो सही प्रकार posture the client counselor should show towards the client। maintain eye contact। counselor ତା କଥା ଶୁଣୁଛି କିନ୍ତୁ କୌଣସି eye contact ନାହିଁ। in that case the client feels disconnected with the counselor। so the counselor as much as possible should maintain the eye contact, but that too depends upon the facts being disclosed by the client। से client बहुत sensitive आउ sorrowful facts गुड़ाक कहूची काउंसिलर को। at that time the client himself or herself wants to see at the floor, not at the eyes of the counselor. ସେଇଥିରେ counselor ତାକୁ ଜବରଦସ୍ତିଆ କରିକି କହିପାରିବନି ଯେ ତୁ ମୋର ଆଖିକୁ ଦେଖିକି ହିଁ କଥା କହ. The counselor will try as much as possible to maintain eye contact. But here the client is not asked or the client is not forced to maintain eye contact. E for eye contact, relaxed mood. The counselor ଏମିତିଆ ନଥିବ ଯେ ଶୀଘ୍ର କହ ମୁଁ ଯିବି ମୋର ବସ୍ ଟାଇମ୍ ହେଇଗଲାଣି, ଶୀଘ୍ର କହ ମୋର ୱାଇଫ୍ କଲ୍ କରିଥିଲା ଆଜି ଆମର ଆନିଭର୍ସରୀ, ମୁଁ ତରତର ହେଇକି ଯିବି. ସେମିତିଆ ପୋସ୍ଚର, ସେମିତିଆ ଏକ୍ସପ୍ରେସନ କୌଣସି ପ୍ରକାର ଦେଖେଇବ ନାହିଁ. He should show himself as if he is relaxed. These are the factors or the setting. Then coming to client quality, some clients are given much attention. ସେମାନଙ୍କୁ କୁହାଯାଇପାରିବ yavis ବୋଲି, young, attractive, verbal, intelligent and successful clients are given more attention and they are more successful clients. ସେମାନେ ଯଦି yavis client ହେଇଛନ୍ତି, then they are more successful or the success rate is high. Similarly, hound ମାନଙ୍କର success rate is କମ୍. Hound and dude ମାନଙ୍କର success rate is କମ୍. Then counselor quality होची self aware. जदि ହେଇଥିବ counselor, then the counselor should be self aware, he should be honest, he should be congruent, he should have the capacity to communicate and he should be knowledgeable, he should have knowledge in the field of counseling. So these are the qualities of the counselor and these are the factors that influence the counseling process. And next is the theoretical approach to counseling. I think that we should end up with this much because
Ma'am, I have a doubt here.
huh,
Like most of the things which we have gone through, I guess we'll take a little time to get into the topic and internalize once we get into gaining a practical experience in that. But right now, suppose like we would be finishing our MA in psychology and specialization is counseling psychology. So what would be a beginner's approach for a counselor to start with when it comes to generating a professional approach?
you can be an assistant to some counselor now. Suppose you find someone doing counseling, or you can go to a counselor who has a clinic. You can assist him or her in her counseling process. Yeah,
Okay.
this way you will learn various things and you will gain experience.
Okay, and like there would be like I'm not very sure as of now because I don't have that much of knowledge. But if I'm like whatever limited knowledge I have, if I have to just start with like I have an interest for child and adolescent counseling,
Huh.
and maybe for family counseling or mental health counseling. So I would identify these areas depending on my interest and then generate upon clients accordingly, right?
You should always follow your interest.
Okay, ma'am.
And
Ma'am,
suppose you said that you are interested in adolescents counseling or school counseling, you can say.
yeah,
Where will you find adolescents? They are in the schools.
right.
So in a school setup, you will find many adolescents who will be needing your counseling. So you can be a counselor as you have a degree in counseling psychology, postgraduate degree in counseling psychology. You can be observed in any school as a counselor, and there you can start counseling the adolescent. And for family counseling, you have to go to someone who is actually a practicing counselor.
Okay, ma'am. Ma'am, one more thing is like, can you give us some references of professional bodies where we can associate ourselves to know further on these lines, like professional networks, like
Okay. As I know, uh, Professor Pratap Kumar Rath, you must be knowing him. Pratap Rath sir. That
okay, ma'am.
what a biryani sir.
Right, sir. Right,
Huh?
ma'am. Right, ma'am.
You can
Yeah.
talk to him. Sir has a counseling group, and he would
Okay.
love to include you in that group also.
Okay, ma'am.
So
Okay.
once you are a postgraduate in psychology with this counseling specialization, you
Right.
can be a member in that group, and some
Okay.
activities, counseling activities, are taken up by sir in that group.
Okay, ma'am. And ma'am, another thing is like, can you give some references of good books which we can refer apart from the IGNO materials? Or
You can refer Gladding book, GLADDING.
GLADD?
ING, Basic Counseling Process. I think the name of the book is Basic Counseling Process, and the author is Gladding,
Okay.
GLADDING.
Okay, ma'am. Okay, ma'am. Thank you so much.
So tomorrow, please come prepared with block 2. Block 2. But before starting our block 2, I will be discussing about the theoretical approaches to counseling, because without this theoretical approach, we cannot proceed to the next or anything in any discipline. The theories should be known to us before discussing any practice or practical or anything we should know. So these are the theories of counseling process. Then after discussing this unit 3, we will go to block 2. Okay.
Okay, ma'am.
So it's my sincere request to you all to go through the study material given to you. At least take out half an hour from your schedule and go through the book, block 2. Okay.
Okay, ma'am.
Okay, thank you.
I just wanted to ask in the group, like, any one of you have started your internships?